Hi everybody, my name is Anna. I'm Dr. Grosser's physician assistant. It's nice to talk with you today. We are going to be going over post-operative instructions and expectations in this video. I work with Dr. Grosser in the operating room, and so I'm there from start to finish in regards to whatever procedure you go through, and I'm helpful for you after the procedure, seeing you in post-op visits, and going over all of these in detail during those visits as well. This video today will just give you a nice brief overview of what you can expect after foot and ankle surgery, and something that you can refer back to in the future if you have any other questions or concerns. So starting out, after the surgery, we do have you wrapped up in a lot of different bandages, sometimes a post-operative shoe or a splint. With that splint or shoe in place, you do need to be cautious with that, so that way we don't disrupt our surgical site. It is advised that you do kind of wiggle toes or pump your ankle up and down after the surgery to increase circulation in and out of that foot and ankle. That is going to help with your swelling and should give you some relief in any discomfort that you may experience staying in one position for a really long time. After the surgery, for that first week, we ask that you elevate your extremity for 45 minutes of every hour. That's a lot of downtime, and so making sure that we are doing those ankle pumps or toe wiggling will help you with any discomfort you get from that. When you do elevate, we do ask that it is above your heart, and a good guideline is always toes to nose. That makes sure that it is high enough to assist with decreasing your swelling and getting any congestion out of the foot and the ankle. When you do elevate, we ask you to do something called a floating heel. And what that means is when you elevate on a pillow or a wedge pillow, what you do is you hang your foot off of the edge of it so that your heel bone, your calcaneus, does not have a lot of pressure that's placed on it. If we have a lot of pressure for a long period of time, you can create something called a pressure ulcer. And that will be something that your body will also have to heal during this time of recovery, and we can avoid that by doing this floating heel. Adjusting the position either laterally or medially when you're elevating will also help with that and also help with discomfort. You can utilize ice packs after the surgery if it can penetrate deep enough or you feel that it can provide you with some benefit of inflammation relief. Placing it on the opposite side of wherever your incision is advised. If that incisional area does get wet, we need to redress the area so that way it stays nice and dry. We avoid a risk of infection. Typically after surgery, when we do not move around a whole lot, we are at risk for something called a blood clot or a deep venous thrombosis. This is something that happens when the blood flow slows down and becomes stagnant. It can create a blood clot after it loops over and over again, forming a little ball. That ball can become lodged in your calf as the most common site for a deep venous thrombosis, and it is a very painful, it swells your leg, it can cause extreme discomfort that is not controlled with your pain medication that we provide you after surgery. If anything like this were to happen, we would want to know immediately, and so calling our office or the emergency line, if it's after office hours, would be advised. To prevent that from happening, we do ask that you take 325 milligrams of aspirin every day for 4 weeks. This is an antiplatelet medication and it helps thin out the blood and avoid a blood clot risk. If you are somebody that has a clotting disorder or a family history of clotting disorders, medical clearance by a primary care provider would be advised just to see if there's a different regimen that would be better suited for you, if not the aspirin. Again, when you wake up from surgery, you will have that post-operative shoe or a splint in place. This here is a post-op shoe. It is a very stiff base. It does not bend. It has 2 separate pieces of Velcro to help stay on your foot and remain sturdy. This will be worn, depending on the type of surgery, 4 to 6 weeks afterwards. If you are waking up with a splint that is likely from a post-operative ankle surgery and we will assess if you need to do another splint at your first post-op visit or maybe transition you into a boot, and that will be shown to you at your post-op visit. Depending on your degree of swelling, we do tend to get people into that boot immediately afterwards, but sometimes we do have to resplint you for another week. We just have you come back after that to resplint you again or get you into a boot. With that being said, most of our splints need you to be non-weight bearing during your recovery process, and sometimes with the post-op shoe as well. What non-weight bearing means is that you do not place any pressure on the foot or ankle, at least until we advise you it is okay. Most of the time, you can put your heel down to do what we call heel balancing, just to steady yourself when you're up and moving. If you need assistance with ambulation, especially if we have you be a non-weight bearing patient, you will need crutches or a knee scooter/walker, a wheelchair, or a walker. That depends on your type of surgery and the complexity of the recovery process. We will talk with you in the office about what your expectations should be in regards to your weight-bearing status, and we will advise you along the way to see when we can start to put weight down on our foot or if we can start that right off the bat after surgery. When you come in for your post-op visits, we will also talk about dressing changes. It's advised that immediately after surgery, until you come in for your first post-op visit, that you do not remove the dressings or the bandages. We will remove those in the office. When those are placed in the operating room, it's in a sterile environment, and that means that everything underneath the bandages is still sterile. Sometimes we don't see patients for 10 to 14 days after the surgery, and it is okay to keep that on for that time period. If we take that off too early and you expose your incision to the environment, you run the risk for infection. We do send prophylactic antibiotic regimens after surgery that you will take to help prevent this from happening and also give you a little bit of ease of mind that things are going okay underneath those bandages. With those bandages as well, we do request that you keep that area dry. We need you to bag the foot. There are modalities on Amazon, or a plastic bag and some tape around the foot and the ankle will help keep that dry whenever you're bathing. If you were to use a shower, I would advise that you use a stool to sit while you are bathing yourself, so that way you're not trying to balance on one foot. That would be dangerous, and I don't want you to fall. If you are more of a bath person, sometimes just hanging your foot out the side of the bath is also okay, so long as it stays dry is the main goal. Once your incision looks like a scar, that is when we are able to get it wet in the bath or the shower. That usually takes about 4 to 6 weeks depending on your body's healing rate. Until that point, we need to keep that area dry. When we get to a scar position, we will talk about scar tissue massage therapy. What that entails is actually massaging the incision and the scar so that it breaks down the scar tissue that's building up underneath. That process will last for months after surgery, and so scar tissue massage will be beneficial for you for several months. Mederma and Scar Away are 2 topical creams that are helpful with scar tissue massage. They help penetrate the skin and break up that scar tissue. Those can be utilized during this process, so it's not skin on skin and abrasive when you are massaging that area. It helps desensitize the nerves that are now forming and help make the appearance of the scar a lot nicer. For post-operative pain control, I typically send a regimen of 4 different medications to your pharmacy. 2 of those medications are pain medications, one of them being a hydrocodone, which you can take every 4 to 6 hours as needed for pain, and gabapentin, which is a nerve medication that you will start out taking only at nighttime, and that will help with your nerve pain. 2 of the other medications are a nausea medication as needed in case these meds or your surgery make you feel a bit queasy. And then that 4th is that antibiotic that I mentioned previously. We will utilize these medications as your regimen as long as you need them, and we'll continue to help you with those prescriptions as we move forward in the recovery process. The pain medication of hydrocodone we will refill that for you. We just need to make sure that we stick to our state guidelines and make sure that we are prescribing that in a safe manner for you, as it is a narcotic prescription. We do ask that you start out alternating between ibuprofen and Tylenol immediately after surgery. The Tylenol and the ibuprofen will start out as some of our pain medication regimen. Alternating between the two of them will help cover different pain pathways and give you more coverage. We will cycle through those medications throughout the day and week by week as we go on in our recovery to make sure that our pain is minimized. If our pain is elevated, then we take the stronger medications to help bring it down to a tolerable level. You will be the judge on what medication you should be taking. When you are starting out with your medications, I recommend starting with ibuprofen first. A few hours after that, move to your regular Tylenol. A few hours after that, if the pain is still increasing, then you would move to the hydrocodone. If your pain is staying pretty constant, keep with the ibuprofen and Tylenol until it does peak or it continues to drop further down the pain scale. Again, the gabapentin will be utilized at nighttime only. It does have a drowsy side effect, and so I don't want you taking that medication during the day. So if it makes you dizzy, drowsy, or woozy, only take it at nighttime. If you do not have any of those side effects, it is one that you can take during the day, and we will adjust that prescription as it seems fit. The hydrocodone, the pain medication, it can cause constipation, and so with that, taking a stool softener like Colace or Miralax will help with your bowel movements. The antibiotic that we prescribe can have a side effect of diarrhea, so we hope they cancel each other out during that first week or so when you're using both. Again, that nausea medicine as needed if you do feel queasy or nauseous. Depending on the type of surgery, we do sometimes prescribe physical therapy. Typically, this happens at the point when the patient can walk fully on their foot or ankle without having a lot of pain. There may still be some discomfort, and that's where the physical therapy comes in to help you rehabilitate your surgical extremity. Depending again on the type of surgery, you may or may not receive a prescription, but you may always ask for that if you feel it is something that you need. We tend to have 3 to 5 follow-up visits with our patients. Depending on if you get an infection, you have any injuries, or any other concerns, that 3 to 5 is just an average. Some people have more than that. We will always fit you into our schedule if you need anything from us, so that way your needs and concerns are met. There is a list of emergencies for when I would want you to contact the office, especially fevers over 101 degrees, pain that is not being controlled with your current pain medication regimen, swelling that is not going down with your elevation, you start to notice red streaks creeping up the foot or the ankle, or you accidentally submerge the foot in water. That is just a basis of concerns that I would need you to call, but anything that comes to mind, please give our office a call, and the number is placed on the front of your surgical packet. If you have any further questions, please give us a call at our office, and I'd be happy to answer them for you.